Good afternoon. My name is Inez Miyamoto. Thank you for joining me today on the Daniel K. Inouye Asia Pacific Center for Security Studies Women, Peace and Security program. Joining me today are Beth Eggleston, Pip Henty from the Humanitarian Advisory Group, and Beth Kunce will also be leading our discussion today.
Inez told me that she was doing this, and she said, you know, do you have any good recommendations for a group to talk to? And I was like, yes, you need to talk to HAG and this Humanitarian Advisory Group. And it was just dynamo group of women, and they came together and they created something. And there's a lot there. There's a lot there. You created something because you needed to keep doing the work, but you created what I think is a model for going. So it's something that really empowered women when you kind of hit these roadblocks. And I'm going to ask you guys to talk a little bit about that professionally. When you have children, you do all these things, you all of a sudden you're right. So you created this space and you have this high quality product. You've got these people with tremendous backgrounds that have this reach in this network. And it's really the quality of who you are as people and the quality of your product. And in this short period of time, you guys are the top people folks go to for these regional reports and publications. You guys are kicking butt. So I was like, oh, we have to talk to them. It'd be awesome. And I sent you some questions, but if you guys could just talk a little bit about how you got your start, and I sent you a little bit of background, and I think you guys are a model, and I want people to hear your story.
Oh, thank you so much, Beth. And it's so lovely to see you again and to meet you, Inez. And thanks for the opportunity to chat with you, because when I came through Hawaii, I did get to actually come and see your institution, but we haven't got strong connections yet. So it'd be lovely to foster those a bit further, because you guys really have a focus on our region, and we don't think there's enough focus on it. So the more the merrier. So I hope this is the beginning of many more collaborations. So you're exactly right, Beth. We started HAG because the international humanitarian system, as you would know, it's quite old school. It's quite a huge lumbering system, bureaucracy, and we wanted to do something a bit different. You're right in the way that we also needed to do something different so that we could remain as a part of doing humanitarian work still. So we were started by 4 women who had been working in the field, in field locations, doing humanitarian work with UN, World Vision, Oxfam, Red Cross. We'd sort of whole bunch of people coming together, and we decided, let's start something. We were inspired, I have to admit, quite a lot by Humanitarian Policy Group out of the UK, and also Humanitarian Outcomes out of the US. So doing interesting work. And we remember sitting in the field as practitioners and waiting for, the latest HPG report to come out and be able to use that in our work. So we wanted stuff that was going to be really relevant at the time and very practical. So we wanted to ensure that we were that practitioner angle, but we're also asking the harder questions. And I guess setting up in this way, we're very independent. We're able to put a mirror up to the system. And the idea is that we are able to ask those hard questions because we're not operational. We're not delivering aid. We're not, on the ground being that frontline agency at all. We're very much intentionally the ones to step back and say, okay, if you want to come and get someone to provide you an independent evaluation on how we think your program's going. And I think operational agencies now know that if they ask us to do that, we will ask the hard questions. There's some difficult conversations there. So we do the evaluation and monitoring piece, the research piece, training and education. And we also do technical advice. So that could be everything from reviewing and creating simulations and exercises for an organisation, right through to helping them develop their policy. And as you mentioned, Beth, the model that we set up, so we are uber flexible, I suppose. So the way in which we work is we're a small team. We're based in Melbourne in Australia. We are 11 currently, and that's 11 staff based in Australia. And so we only go to the office once a week, which has meant with COVID rolling in that we were very fortunate because we were actually set up to work remotely. So once a week, we've been heading into Melbourne and working in a co-working space there where we get to see each other, make decisions, work on projects and meet with clients. And then the rest of the time we're either traveling, well, we used to be, or we're working remotely. And we made the decision early on, and it was an interesting conversation to say, well, are we going to be an NGO? Are we going to just be one of the many other NGOs that are floating around doing different things? And we did make a decision then to be a business. So we are structured as a business, and we are a social enterprise, which means a few things. And I know that in the US, a social enterprise is actually a legal definition. For us in Australia, it means that at least half of any profit that we make is reinvested in for a social purpose. So for us, that's to support the humanitarian sector. That could be through pro bono research, pro bono events, a whole range of different things. And it also ensures that we hold ourselves to the highest standards ethically. And yes, we do that because we think it's good business sense and it's the right thing to do. But we felt it just helps you get up in the morning. We wanted to create a culture in our organisation that people wanted to work with us, even if we couldn't provide the highest salary in the world. If you can provide people with flexibility and a workplace where people want to bounce out of bed and actually come in and work with the team, we sort of felt like that was actually the critical bit, because no one wants to work with an organisation that they think, oh, you know, here we go again, or this is dull, or there's blockers. We're also a bit radical in giving people responsibility at all levels of the organisation. So people are empowered to make decisions. And I think some people find that a little terrifying when they first start. No, you just work it out. Yeah, do whatever you like. And and then our values are really what drive us. We want to be, and our values are about being brave, brave and courageous, being ethical in everything that we do, being flexible, and really empowering others. We feel there is so much work to be done in this area. There is no room for competition. So people would say, oh, this organisation, they're one of your competitors. Every single one of those that could be one of our competitors, we do joint work with, we collaborate with, because we just feel like there's more than enough work to go around. So that's sort of the kind of general structure of who we are. And I'll get Pip to talk a little bit later about some of the substantive projects that we've been working on.
So I'm curious, the working 1 day a week and going in, there's a couple of things that you've done. So you've set up a model truly that a lot of organizations right now trying to figure out how they adjust to this COVID environment and not knowing how long it's going to last. There's some things that you might have learned from that, but there's also quite a bit of work that you've done on remote guidelines and remote work as well. And that is such an important, and everything that you're saying about your ethical standards for humanitarian work, doing it remotely, it makes it almost harder, right? So if you could talk a little bit about how COVID, some of the things that you have learned from your own experience as an organization about remote work and making this successful, and also with the humanitarian community doing remote work in COVID and still trying to keep those principles and that loyalty and support to the folks on the ground, and how that works out in this COVID environment.
Yeah, great question, because we did a bit of soul searching, I have to admit. When this first happened, we sat down and thought, okay, we're not an operational agency. How can we add value in this space? I mean, we feel fortunate because we've got our working environment within HAGs set up, so everyone has a safe and a, productive place to work, and we supported that before COVID had hit. But we really did, as a team, we came together and said, well, what is this going to look like? And not only that, how can we build a body of work that is going to ensure that we're relevant in 6 or 12 months' time when people are looking for organisations to either evaluate their programs or whatever that might be? So that was the beauty about having a small team, I guess. So Pip and the team, we sat and we came up really with a suite of services, and we said for the next 3 months we're going to do as much pro bono work as agencies need. So we reached out. Firstly, one of our colleagues, team members, Jess Lees, put together a piece you may have seen. It was a think piece on looking at what if in this COVID environment we have a massive humanitarian emergency. What will that look like? Suddenly you're not having the white knights riding in to advise local people on the ground what they should be doing, but you won't have that logistics capacity coming in. What will it look like? So Jess went forward and developed this think piece that we then sent out to everyone, and it had a range of different challenges and opportunities in that. And then we just reached out to different operational agencies. So we were doing some work with CARE. We did some strategy work with Save the Children. We did a piece with Caritas. We even helped the resident coordinator's office in Bangladesh, who were pulling together their sort of response plans. So we were able to say, send us some of your data analysis, helping them pull together. They just needed more people because they were, you know, the time frames there were really short. So we spent sort of 3 months. We were also giving lectures at universities. So we sort of, and it really helped us because in working with all these agencies, we were getting to better understand, okay, what are you finding challenging about this environment? What's happening with your local partners? And the other piece was being able to work with our partners. We have a whole range of different local partners we work with, in particular one in Indonesia, an umbrella body in the Pacific, Piango, and we also work with a research organisation, Neuropad, in Bangladesh. So actually, as you would have seen, all these online events started happening. And as you would also have seen, sometimes you see the same people just on every single event. We thought, okay, well, let's get, you know, the Pujiona Centre from Indonesia. Let's hear what's happening in the Pacific. We're getting our people there. And suddenly we were excited to see there was actually more, you know, different perspectives around the table through some of these online events. So we felt like we were able, again, just to get the conversation started. We're not going to pretend we have all the answers. It was more around making connections, providing a little bit of surge capacity when organisations needed it. And also, I guess, it's as a sector, we're trying to chart our way through. And I suppose that's where the practice paper on localisation in Tropical Cyclone Harold, which was really interesting because this was sort of the test case, right? You know, and everyone's like, what's going to happen? We're not having any of the internationals being able to fly in and do their thing. So what is that going to look like? It was almost that transformation was happening by default. We really wanted to be able to capture some of the learning for that.
Pip, do you want to follow on to that? You actually were the lead, or you one of the folks on the localization of aid, because that's actually quite. That's the other part is the remote, but there's also the localization of aid. Everybody is really it's everyone for themselves right now, where there be, since it is a global crisis, right? It's not that we all descend upon one area and try to work together. We're all covered down. And you guys are both quarantined right now, right, in Melbourne? So it's this strange environment where you, as you're saying, the big logistics machine, all of the operational but that's also been the movement of the humanitarian system, is to get away from the international aid and move to the localization. I was just talking to Inez about that with the Global Humanitarian Summit now in 2016, and that even before that, we've been trying to get to that, and you guys have some of the top products on localization. So what are some of the things that you've learned from your work in localization that, again, this is incredibly relevant to COVID and not just Oceania, this is globally relevant?
Yeah, and really, really good question. And I think leading on from what Beth was saying in terms of how we work is one of the key successes for us during COVID has been our network of regional consultants and advisors and research partners that we work with. So we aim to apply a principle of, if we're doing any work in any country, we aim to engage a national consultant, a research partner, either our regional advisor or regional associate as well. And it's a principle that we were excited to apply when we decided to conduct the practice paper for TC Harold and COVID-19. So we had a research partner we worked with before called Bango, which is the umbrella body for Vanuatu for NGOs, so the Vanuatu Association of NGOs. So we're incredibly fortunate to have that relationship pre-established, and we also have a regional advisor as well who sits, regional associate who sits in Vanuatu, who's been with us, Beth, for how long? Like longer than me, I think, like 6 years. So she's wonderful, Linda. So we were able to mobilize and get the data collection process underway quite quickly. And I think that in itself, that our practice papers and doing a research piece on localization was conducted in a localized manner as well. It's something that really excites us. And they, you know, kind of our research partners were involved in everything from methodology and tool development to translating the report into Bislama, which is currently happening. So it can be, it's fully accessible to local partners as well. I think there's some really interesting findings coming out of the paper as well. We conducted a baseline in a localization baseline in Vanuatu in 2017 it was, and it was around measuring localization in Vanuatu, and particularly after TC-PAM that hit. And I think it's really interesting. I think what we saw was that there was a real step up in national and local leadership. Not to say that wasn't without its challenges, but that because you know, because of COVID-19, there wasn't that influx of internationals that we generally see in the Pacific. We have seen the Pacific. So I think that's really exciting to see that the government came out really early and said, no, this will be a nationally led response. And I think with that, though, there were some challenges in terms of, although national and local leadership definitely stepped up, and as I mentioned, you know, that was playing out, it wasn't met with a step up of direct resource allocation in terms of funding. So we're seeing some really exciting shifts and movements there, but we're still seeing some areas that are challenging. And there's so many reasons for that, and the complexity of having TC Harold, COVID-19, they had a change of government, they also had ashfall from the volcano, they had a flooding, so there were lots of things going on. And so I guess the purpose of the response as well of their paper wasn't to provide a full evaluation, it was just to provide a snapshot in time. This is where it's at, and this is how NGOs can support their local partners differently or better, and to strengthen what they're already doing as well.
I was told that the spacebar unmuted. It's a lie. I'm sorry.
Oh, technology.
Technology, it always gets me. But a lot of your work and the reputation that you have, you're doing research and you're writing these reports, but really you're saying Pugiono Center, Pugiono, who's been involved since the tsunami on, right? You are developing these deep relationships. I think that's the important part that might be missing in some of these other things, and part of your success is that you're actually building a relationship within the region. It's not just writing a report, it's a living document, right? It's a reflection of relationships that you're building. And I think that's very important to this work, because if you're trying to build capacity and if you're trying to identify needs, a standalone report that's not a living document, that's not based on these relationships and networks and empowering, like what you're doing, they'll fall flat. They'll completely fall flat. So your model and how you go about this, I'd like to hear more about your partnerships and how you've seen these grow, and the care and feeding of them, and how these research projects serve as a partnership as well, how that might work out. Because I think in this virtual environment, that the relationship, the human face-to-face in working on these issues, we're gonna need to do more and dig deeper. And I think you guys may have some answers of how we can all do better in this area.
That is such a great question, because I must say our team members are so passionate about the concept of partnership. Yeah. And partnership is not a contract. So we often hear, you would know, of NGOs, oh, our local partners. Oh, you mean the people you just have a contract with who implement the work that you want them to do. That's a contracting relationship. That's not a partnership. And I think that's what we found quite interesting, because someone like Pugiono Center, the first time we engaged with them, it was around, we were applying for a piece of work. We wanted their local knowledge. They come on board. We did it together. Then the second time, no, I think actually we got the piece of work, then we asked them afterwards. Second time, yeah, we put in for a piece of work together. And by the third time, they were just getting work on their own, and they'd contract us back like 1 or 2 days. So that's how we got to know one another. And now we're doing things like just creating events together, nothing to do with contracts, or talking about business models together, working around, what kind of different skills and knowledge a Pugiono Center wanting at the moment, what kind of things is HAG wanting. And so we're having more of it's just more of an equal footing, and more of it's very much a two-way thing. Although, I mean, many of us would think that we get far more from working with the Pugione Centre and Pugi than they would get from us, because they're so incredibly well connected. And as you were saying, Beth, this incredible experience of work across many countries and many organisations. You know, I tease Pugi that he's the father of the Indonesian disaster management system, which he quite likes. He pretends he doesn't like it, but he loves it. So I think we feel incredibly grateful that we have sort of developed a relationship where we're able, you know, on the WhatsApp sort of, you know, finding out what's going on. And we did a lot of thinking together around the response in Sulawesi, because that was also another really interesting one where, you know, the Indonesian government was, you know, sort of saying, actually, we've got this. And it was really interesting from an Australian point of view, of people saying, oh, no, this is terrible. Like, there's going to be a catastrophe in this area because, international agencies can't go in. What's going on? And then it was great hearing people saying, no, it's going really well. We're not needed here. So I think, to be honest, I think when it comes to the systems change, and you would have seen so much about this, you know, online over the last 6 weeks around like decolonizing humanitarian aid. I mean, and this is all a part of it. This assumption that so-and-so, this organization, no capacity. They wouldn't be able to do it. They wouldn't really know. It just infuriates us. So, I mean, my co-director, Kate Sutton, it was a few years ago, and she got asked to sit on a localization panel, and she looked at the different people on the panel, and she's like, are you actually serious? We're going to sit here, a bunch of Westerners, and talk about, like, absolutely not. I'm just not going to do it. I'm not going to sit on the panel. So I guess we've been able to, we were just lucky we've been able to leverage and elevate and just connect some of our partners, because they're doing the stuff. We're able to just sort of say, oh no, if you just chat to that person, you're the one who'll go and present at the conference. It doesn't have to be us. And that also works into our model of not wanting to, you know, ruin the planet further and fly around the world with all our emissions. But I think with the partnership piece is why another reason where each research product we have, pretty much it's always with some kind of operational partner. So when we were able to pivot, you mentioned the guidance notes, Beth, we were already doing some of these different practice papers, and we were able to actually change direction, and we partnered with CARE, with Caritas and
Glow
consultants from Pakistan. So we were able to talk about remote facilitation or remote monitoring and evaluation. What does that really look like? Because suddenly everyone was having to do this. And we were already doing some work with Caritas and doing a very big strategy piece. And we were meant to, you know, having 40 or 50 people to, you know, pulling together a consultation. I remember thinking, it's not possible. Now COVID's hit, we can't do this, right? We're in, you know, these are NGOs. They can't work without butcher's paper and Post-it notes. It's impossible. So it was really amazing for them to say, well, let's try and see how this can work. And I didn't know about Zoom breakout rooms. And in a way, it's quite fun because you just say, and, you know, all the NGOs stop, they brought back together. So we decided, let's capture some of that learning, let's share it. And let's also see the good part. I think there are some elements that there almost is, in some ways, more inclusive approach to some of these things now are online. I think we're hearing more diverse, more interesting voices. I'm invited to listen to things that we weren't invited to listen into before. So yeah, I think it's a really interesting time, and we have to make the most of it.
So I have a question. You brought up that you worked on simulations and exercises. What does that encompass?
Great question, Inez. So not only have we done quite a few with NGOs, so for example, if an NGO wants to test their internal standard operating procedures for an emergency, we've done sort of desktop simulations where we're able to have a scenario, and people then kind of trigger all their different policies and procedures and seeing how that goes, and, you know, calling into a field office, oh, that's right, the sat phone is broken, or that doesn't work. So just getting to test that. But the other piece that we have been lucky enough to be involved in is quite a lot of civil military exercises as well. So everything from Talisman Sabre to other Australian-based exercises. And I think that's really valuable because, as you would know, NGOs often just don't have the resources to be involved in long exercises. And I'm not sure, I know that you have other people role playing in some of these exercises, and maybe it doesn't always work so well. So I would like to see more collaboration, and I'd love to see local organisations be brought into working in simulation and exercises. Not just so it's the same old people just, you know, working together again, but saying, actually in this simulation, we're going to have, you know, a local NGO or a local community-based organisation who are actually going to give their point of view, and you could realise, oh, this whole piece of how we were going to work, that's not going to go in the direction we thought it was.
Thank you. Excellent answer. And then I had another question. This has nothing to do with any of what we're talking about, but how do you collaborate with the Australian, the APSC? Is that what they're called? Australian Pacific Security Studies or Center?
So we haven't done much yet, actually. So this is a whole, it's really interesting. This could be one of the areas, because both Pip and I have done quite a lot of work in the women, peace and security space. So we're hoping to actually build that that piece of work and be able to collaborate with other, we do quite a lot of work with the Centre for Defence and Strategic Studies through the Australian War College. And we have done simulation work with the Staff College as well as giving the Peace Operations Training Centre as well. So there's a range of different organisations and more, as you would know, are being created with Australia's pivot to the Pacific Step Up. I think there's going to be more and more collaboration in the security space. And the big question is, what role does humanitarian actors play in that? Many feel uncomfortable about you know, working too much in that space. I suppose we need to find a way in which to have dialogue in that space. It's not that humanitarian assistance is going to be instrumentalized. We have to make sure that that doesn't happen. But I think we have to also work within the realities that are happening, especially in the Indo-Pacific. So we are looking at understanding that space a bit more.
Thank you. Awesome. I would like to collaborate with you guys and the APSC in the future somehow. We can find something to work on because they're doing some WPS work there too. So
fantastic. Yeah, no, that sounds great. We were just involved in some training actually for Australian government employees on WPS recently, and there were people from all different government departments, because usually it's sort of like, oh, we'll get the Office for Women and we'll get the Australian Defence Force. And this is nice to see lots and lots of other departments being involved. And Pip and I have written papers on, you know, preventing violent extremism and women in that space with WPS. We also led the it was the independent interim review of Australia's National Action Plan on Women, Peace and Security. And as you would know, we're just about, the Australian government is in the next few months, hopefully going to be launching our next National Action Plan. So we're keen to understand what that looks like, because there's a lot of talk around, should we still just have these action plans as just externally focused pieces about this is what we do over there? It's sort of a bit reminiscent of the Millennium Development Goals versus the Sustainable Development Goals. So it used to be like, we'll just help those people over there because we're quite perfect. And then that recognition of, oh, okay, we all have a lot to do. And I think I'd probably quite like to see the NAPs, like the National Action Plans, shift towards that, about, oh, we actually have some issues we could look at in Australia domestically. And something Pip and I are very passionate about is learning from the international humanitarian system and what we can learn and bring back to domestic emergency management in Australia, and vice versa. There, you know, is some great best practice happening in Australia. We have plenty of experience with bushfires and drought and a lot of things that have been happening. And the COVID piece is very interesting, also from a civil military coordination piece as well.
Yeah, with 3 different guidelines.
Oh yes, we love a good guideline.
We've got all the guidelines: World Food Program, ICRC, IFRC, and OCHA. But there's just kind of going through what we've been talking about. the talk, your talk of your values, I think, you know, our leadership would have gotten very excited. You said something very close to what they talk about as our model of engagement in the region is to educate, connect, and empower. And you said something very similar. It was most synonyms for each of these words in terms of what you're doing in the region. And I think the other thing that you mentioned, and we've seen this in our career, the time from the tsunami in 2004 to now, is the capacity building that's happened, right? So, but there's also that, and one of the things that you mentioned is that your attitude and HAGs perspective is not competition. That there's always enough work for everyone. And I think that's something that we in the humanitarian community and development community, people get entrenched in their role and what their job is instead of the evolution of it. And the fact is that we're making progress, right? We're seeing capacity. Sulawesi is proof of that, right? No, we've got it. We've got it. And you're seeing that in Oceania too, with some of the cyclone responses. Some of it might be resource allocation, which some of your reports are indicating that there's, you know, the leadership knows what they need to do. It's perhaps just, it's resources. And the organization and the way that you guys are working, you're highlighting this evolution. What things do you see and trends do you see going forward? Should we start loosening up where people are entrenched in these traditional careers of holding on to this Western humanitarian machine? Where do we need to go to get better, to evolve for all? Not just external looking, like you're saying. Yeah. We have to look back. And it's funny because when you said that, I just thought about the pandemic. I was like, we always started doing the planning for the pandemic. Well, help over there. Because think about it at home, you're like, no. So
no, that is so true. And I think this is actually, it's a really hard discussion to have, because it's like, it's super close to home. So for example, us in Melbourne now, as you would have probably heard, so just even in Australia, Oxfam Australia, 50% of the staff is going. And it's interesting because people sort of say, oh, it's so sad, and it's the concept, you know, like it's the funding problems, and it's the, you know, all the publicity, and I mean, I like Oxfam, you know, I'm an ex-fammer myself, but maybe it's time. Didn't we always say that we were working ourselves out of a job? And I don't want to say that I'm just happy to see the demise of organizations, but if we are really going to work the talk on that, perhaps these big international global NGOs and maybe we're moving. That's what transformation is, right? No one would have thought 20 years ago that, you know, that Oxfam would be reducing in such a huge way, pulling out of 18 countries, cutting thousands of numbers of staff. But perhaps we don't need to blame the context. We don't need to blame funding or anything else. Maybe it's just time. Maybe we're actually going to, you know, walk the talk and say, yeah, no, actually, Department of Foreign Affairs or other donors should be giving their money directly to local organizations. We don't need to have a Western intermediary who can say, oh, no, they don't have the capacity. We need to help them. And, you know, what do you think, Pip?
Yeah, and I think that's really interesting, Beth. And I think it comes down to as well, like a shift in the way that we're making decisions, but also that we're leading. So I think it's a push and it's a drive for organizations to internally reflect and say, well, who's at the table making these decisions? How do we stay relevant? How do we continue to and how do we strengthen the trust that we have within the context in which we're working? And a lot of that does sit with leadership and how decisions are made. And we've seen that, you know, as Beth mentioned, with a number of things that have happened over the years, including, you know, kind of the everything that happened with the prevention of sexual exploitation and abuse a few years ago. We saw that really put leadership under the spotlight. And I think there's this incredible push to see things be done differently, but things can only be done differently if you have different people at the table making those decisions. And we're seeing that, I think, in COVID-19, where you've got massive forums of making decisions where you've got not even women represented, let alone persons with disabilities, people from different culturally and linguistically diverse backgrounds. And so I think it's this point in time where it's like we can actually shift the way we're doing things in a really positive way, and we can change the leadership skills that we're looking at, and we can look for leaders and workers that have humility and are able to walk the walk on localization, etc. So I think we're in this really interesting point of time where it could essentially go one way or the other, because we're seeing in some contexts where, you know, localization is really taking off and we're seeing real progress, then others where it's not happening. And I think it's important to ask why isn't that happening as well. And I think that does have to do with leadership.
I'd like, in our earlier discussions, if you could talk a little bit about some of the proudest work that you've done with HAG and some of the things that you see as a model for what you represent. Really, if you could just talk about that.
Yeah, I think this comes down to, so my journey at HAG started as an intern. So I was already in the development space, international development space, and I was finishing off my master's, and Beth actually taught a subject that I was taking, and I reached out and I said, I need to intern with this organization. And as I was interning, the way that HAG approached evidence-based research, but was also incredibly brave in their methodology and in the questions that they asked, really drew me to HAG. And when I started, it was something that I learnt tremendous amounts on over the first couple of years. It was a steep learning curve in terms of how to ask the tough questions and how to create methodologies that ask those tough questions as well. It's not your standard ABC format. It's kind of a bit of P, a bit of Q, a bit of S. And so I think for me, some of the work that I've been really excited and proud of and that I've seen impact on, it's been a couple of pieces. For me, it's our diverse leadership research program that sits under our multi-year research program called Humanitarian Horizons. So we've got a number of streams under that, localization, of course, being one of them, and also diverse leadership. And then there's a third stream called Blueprint for Change, which is what we're working in Indonesia with the Pujiana Center on. And then there's this fourth stream that also is where some of those practice papers and rapid reviews, such as what we did in TC Harrold and Sulawesi and Bangladesh, sit under. I think with the diverse leadership research, and that was kind of created by Kate Sutton, as Beth mentioned, co-director of HAG. And it was this conversation of, I'd done some work with Kate and a couple of other staff members on women in leadership in the sector. And it was, Kate had a conversation with someone who said, it's so much more than women, and you need to rethink where you're positioned as a white privileged woman. And we need to reshift that. And so we are, through a very consultative process, created the diverse leadership program. And basically what that tries to do is determine and create some real evidence as to whether or not the diversity and inclusiveness of humanitarian leadership teams, so those that are making operational decisions, actually has a measurable effect on the quality of a humanitarian response, which is a huge research question, and I think is something that I've been really excited about, because the methodologies, we're really, we're making up, we're testing it with our partners, we're testing it with sector experts, we're testing it with the team and seeing, do you feel comfortable answering these questions? How do you feel about asking questions about your identity and your personality, and how does that then, how do we then measure the effect that has on a humanitarian response? It's never been done. And so what we're doing is we're breaking it down into three key sections. So it's how leaders respond to risk management in relation to the prevention of sexual exploitation and abuse. It's how they foster an environment of innovation and creation in problem solving. And I don't mean just programmatic innovation. I mean things like this process as to how we get approvals on something isn't working. So what is my freedom to innovate and create a solution that's going to be more effective and efficient, and thus lead to a better workplace, better staffing, better humanitarian response. And also feedback loops and community communication in terms of the accountability to affected populations as well. And that's something that we're kind of kicking off at the moment, and excitedly through a national consultant is leading the entire in-country data collection. So she'll be the Pam based in the Philippines, will be our research manager there, and will kind of garner a team of other local consultants to really lead that research, and will support on anything that they need. And it's been wonderful because it's also, we're going through the process of a really collaborative tool and methodology development now as we speak. And that's, that's been over a year in the making as well. So I think that's really exciting. And I think that's evidence that's very much needed for the sector as well. So you hear all this anecdotal evidence, organizations that have women on boards are better at risk management, but there's no evidence of that for the sector, because we don't measure our success based on finances like the private sector does. It's basically how effective and efficient a humanitarian response is. So for me, that's one of the pieces that I find really exciting. And I think the other piece for me is how we support women and emerging practitioners and women humanitarians as well, more broadly. So it's one of the I think core principles for when I started at HAG. It was really fundamental to the work that we do. We've also done work on, last year we co-hosted a webinar for World Humanitarian Day that focused on bringing the voice of local female humanitarians across the region. So I think we had representatives from Nepal, Afghanistan, Samoa. So it was a really diverse range, and just being able to help provide that platform for that voice to exist. I think that's the stuff that really excites me. Beth, I'll throw it over to you for the work that excites you.
I'm just so proud of seeing, so as Pip mentioned, so being an intern, coming to HAG, and another project that Pip's leading on now is the revision of the Regional Consultative Group on Humanitarian Civil Military Coordination. Pip is leading the revision of that document, so which is really exciting. And I'm sure you'll be pleased to hear that when we were asked to provide this revision, the first thing that we did is say, well, actually we want the AHA Centre to be front and centre, logo on the front, on the steering committee. So we're trying to, if you've got any thoughts on how we can better engage with SARC, that's been challenging for us, but working with the AHA Centre, with the OCHA Asia Pacific office, with the Centre for Excellence and others. But we just sort of said, it's fine for Australia and the US to be heavily involved in this, but actually where is this going to sit? Who is going to use it? Let's ensure that really that the AHA Centre are in the driving seat on this. So I just think that that's exciting, and we'll probably want to might be really nice to actually have another call with both of you about that document and how we're going forward on that.
I remember that was something, I don't know how many years, that was when you first were, that was 5 years ago, 6 years?
Yeah, something like that. 2015, yeah.
No, you guys, we're coming up on an hour, and I honestly, I could talk to you guys all day. I think that you've created something magical, and you've created something innovative, and you've created something that both empowers women, but is also a model for going forward that's universal. It is in this time as well. And it's almost like you've been touched by everything that you're doing. You're a step ahead of what is needed in terms of the design of your organization. No, seriously, design of your organization, your approach, and you're definitely a guide, a North Star for us on some of these things that we need to focus on, and how do we make change. There's some folks that we've been working with and collaborating with and talking to about research, and we definitely need to connect you because of some of the things that they're doing in Oceania, some of the leadership projects that they're working on. They will love you guys. But this is hopefully just the start of a more regular conversation, and I can't thank you guys enough for taking the time. And it is, Beth, it is always a pleasure to see you. So good to see you virtually. Hopefully soon. And hopefully you too in person, Pip, after you guys come out of court. We all come out of this this COVID quarantine, and Inez as well, who is just a tremendous woman that I have the privilege of working with now under this new position. So thank you so much, and let's keep the conversation going, and looking forward to the future.